welcome everybody to the Improving Your NHS Staff Survey Response Rates webinar. The NHS Staff Survey, as I'm sure everybody who is joining this call knows, that it is one of the largest surveys, workforce surveys in the world. I should say it used to be the largest, but unfortunately McDonald's is now beating us out for that. So it's now one of the largest staff surveys to run in the world. It is fantastic that we have this opportunity to collect NHS staff experience and measure progress against the overall people promise. I want to say thank you today. We have three panelists joining us, Jag from Picker, Susie from Blackpool Teaching, and Rachel from the Dudley Group, to talk about their experiences of improving the NHS staff survey and NHS staff survey response rate, and ensuring that we have that active engagement from which we can work and build and improve people's services. I'm going to hand straight over to Jag to give a bit of an introduction and to talk about how Picker can support with the NHS staff survey. But I do want to say we've already got quite a few questions for our panelists that have been pre-submitted. If you can think of anything, please do pop it into the chat. I'll be keeping an eye on it and we'll ask them of the panelists in the group discussion that is coming about halfway through this session. Also, please do feel welcome to add your comments and any feedback or ideas that you also have for improving the NHS staff survey response rate. It'll be fantastic to hear everybody's ideas. So without further ado, I'm going to hand straight over to Jagdip from Picker to give a bit of an introduction to himself.
Hi, good afternoon all. I'm Jag, so I'm the National Programme Lead for the NHS Staff Survey this year from Picker. So I just want to go over how we can help engage and sort of drive engagement within your organisations to try to get the best response rates for you. So there's going to be a key word that I'll probably be using for each stage. So I'll go before we start field work, during field work, and then what Picker can do after. The first one is obviously, and some of these are probably going to seem very basic, so I do apologise, but the key thing is going to be publicising exactly what we're doing. So we do say to try to use multi-formats where possible, so go as broad as your organisation can in terms of posters, newsletters, any sort of bulletins, and really these need to be coming from leadership. So if you've got an opportunity to put messaging out from chief execs or leadership teams, that all really helps in terms of getting messages across to everybody. Picker can and will now be this year redoing our posters. We had decided not to go ahead and use NHS England their digital documents for this, as we didn't want to double up, but just from the sort of level of demand, we will be putting these back together so that they will be circulated within the coming days. Again, we can do things like auto signatures and screensavers, and to even go as far as putting up posters in restrooms and just somewhere where it's always going to be front of mind. In terms of, it is great having this sort of publicity out, but it's really important in terms of what the messaging actually is, so that we need to actually sort of demonstrate what the strategic purpose of the research is for your organisation, explain how the results are used, and give examples of improvements that have been made in previous years, and how the research actually helps drive improvements within the organisation. Again, it's really good if this messaging can come from senior teams within your organisation. The messaging needs to be clear, so all staff know how seriously your organisation is taking the survey. So that main part of publicity of the research is going to be a key driver to engagement. We can then go into other things that Picker are working on currently. So I'm hoping everybody will be engaged in creating their staff lists ahead of the September deadline. So again, we just need to make sure that this is clean, that there's no mistakes in email addresses, or we have all the details that we need. So it is worth investing a little bit of time in making sure that those elements are correct, so everyone has the very earliest opportunity to take part. So obviously, if we can get stuff out very quickly, we see response rates starting to and engagement sort of dropping off. So the earlier the possible we can get this in, the better. There's the next part is obviously making sure that your staff are comfortable and knowing that it is confidential. So again, Picker are willing to help with this. So we put out a small part in our welcome pack, but if there is further information that you need, or if you'd like us to add to any of the communications that you want to put out, feel free to get in touch with us, and we will be, we're more than willing to add and even put our names behind it, so that it's not just coming from the messaging just from your organization. We understand that this is a problem across all organizations in terms of getting the confidential message out, so we will do our absolute best to support you. And then the final thing is just making it easy, and making it, getting the best format for everybody to sort of take part. So again, this is a part of where we're offering paper or online methodology for people. So again, it's important to identify your staff members, so we know exactly which format would be best for them, and exactly how we can contact them to make for so their response can be made as easy as possible for them. We then just move on to during field work, so that would all be sort of hopefully going on, that those bits would be hopefully going on now. So as of hopefully, if we can get an early launch sort of mid-September, obviously, or very early October would be sort of during field work. Again, the publicity and the sort of continuing to drive exactly what your organization is doing is key. So keeping the profile of the survey high, again, we can do this during with posters or sort of updates. We do recommend using the response rate dashboard that we provide, and really targeting communications if you can see response rates being low in a particular area. So really finding out if there's any barriers in that particular area, or of the organization where response rates are low. It might be a case of we need to switch a methodology, which we can help with, or it might just be a little bit more of a push in terms of the communications that are going into that area to help drive it. The other area that we can look into is just sort of creating some healthy competition within the organization, and we do say healthy. Obviously we don't want to turn it into an absolute battle for every, or to be too pushy. And a part of that, we can help use incentives such as prize draws or voucher schemes that we do offer. Again, we can help with posters in terms of reminder posters that can be put up. Again, we are working on this currently, so they will be customizable to each organization, so you can put your logos on there and you can put them up around, again, you can put them up everywhere, or if there are particular areas that need it, you could focus them in there. the final part, and again, you know, just going back to the drawing, keeping the survey sort of upfront and high profile is going to be the key there. But during and after, you know, the publicity in terms of what's gone on with the survey again is key. So what we're trying to do is trying to get away from comments or free text comments which sort of appear as we do this every year and nothing changes. So really what the key is to publicize exactly what has gone on during the survey, what the next steps are, how the responses are going to be used to drive improvements, and just keep on top of the actions that the organisation are taking to sort of implement those changes. So there is, you know, everybody's actually seeing the actions that are taking place as a result of the survey. So we do offer additional sort of free delegation, you know, places for additional sort of the overall response, and so you can discuss it in terms of the whole, you know, the whole of the NHS, and again we can sort of come together as we are today and discuss, you know, what's going on. So we can then, you know, hopefully push that forward, and just sort of keep everybody informed into, you know, how progress is being made. So I think that is literally everything from my side in terms of what we can do, and how we suggest we try to get engagement up. I'd say that the main takeaway of it is obviously publicising and keeping people and keeping all staff members informed of what's going on and how it's actually helping. So I'll just very quickly pass you back over to Hanan. We can carry on from there.
Thanks, Jag. Some very practical suggestions there, and I do want to say that if you have any questions for Picker, please do feel welcome to get in contact with us directly. As Jag said, we've already actively changed some of the processes that we are going to use for this, including the production of posters based on the feedback that we have received from clients, and we can turn that around as quickly as we are able there. Now I'm going to hand over to Susie from Blackpool Teaching to talk about some of the fantastic increases in response rates that they've seen in the last few years. Go on, Susie.
Thank you so much. Just to introduce myself, I'm Susie Srivastava and I lead on the Well Team and Engagement at Blackpool. Can everybody see that screen? Perfect. So just to really pay tribute to Lee Barnes, who was our Associate Director across both Blackpool Teaching and East Lancs until earlier this year, and actually conceptualised the influencer brand, which I'm going to talk about, and obviously Claire Jones, my opposite number at East Lancashire, because we work in conjunction with them very closely. So just trying to page down it, doesn't want to do it. Right, I'll stop presenting and I'll start again. Okay, so welcome to Blackpool. We're a mid-sized acute and community trust with 7,500 staff at this point last year. And just to frame the context, you can see that between 2017 and 18 surveys, very little change, and we didn't really do anything. The concept was the survey washed its own face. We just left it alone and saw what people came back with. And actually, that's broadly speaking in line with the Gallup data that around 36% of your staff are intrinsically motivated. So what changed? Well, we got a new CEO and HRD in the beginning of 2019, and the engagement team was formed. I joined the trust in August 2019 and took over the deployment of the staff survey. From that baptism of fire, you can see that we introduced the influencer brand, we introduced champions, we partnered with East Lancashire, And last year we took it a step further and had much more direct contact with the line managers. So you can see that last year we saw just under a 10% increase year on year on our survey response rates. So I'm going to talk you through the Blackpool model and how that worked for us. Just thinking about the basics now. So last year, obviously we do a full census every year, but what we did last year was to really minimise paper copies. We looked at the uptake for those. We realised that they weren't as accessible as we thought. And though for staff on parental leave and on long-term sick, they're undoubtedly a really useful option. For some of our staff, we found that it just wasn't working, so we minimised those. We also introduced the influencer brand. You can see from some of the branding on your right that we have selfie frames and pull-up banners everywhere. And the triple aim of the influencer brand was to promote the survey, the vaccination programme, and winter wellbeing, which is something that we need to push every year, well, all year round, but particularly in winter. The feedback loop and the annual cycle, I see the staff survey very much in the fieldwork period in particular as the output from the work that's gone on throughout the year. And throughout the year, we're really keen on feeding back on what we've done in relation to what people told us. So even if it's just small shifts on that dial, people know that we're working on what they said and that they're getting regular updates. And hopefully that maintains that level of trust and that psychological contract with our staff. Executive advocacy is so important, and we got a new chief executive last September, October. She's very proactive and she fronts our survey for us. I'll talk a little bit more about that as we go through the survey. The promotional activity is something that's really important as well. I've noted the revised NHS England guidance this year, which suggests that we focus on the basics of nutrition, hydration, and team-based rather than individual promotional activity. So last year, we did offer fresh fruit hampers on a weekly basis for the most improved teams. The executives would present that and we'd put the pictures and the updates in comms. And we did, of course, have our selfie campaign. So we would put the influencer selfie frame pictures on social medias and we would choose winners at random to get a healthy goodie bag. So everything tied in with that promotional activity cycle. We do also utilise the picker programme. We have individual Amazon vouchers. Really, we find that as we go through the survey, it just adds a bit of something to talk about. It's more that than anything. So the promotional activity has been very successful for us. Talking about comms support now, and I know that Jag mentioned the importance of raising awareness. We put branding everywhere. We have infection prevention control friendly wipeable self-adhesive posters. We put them everywhere. We have banners that we put outside our hospitals. We have pull-up banners as well. We really make the most of branding on our staff menu screens. We have the logo coming up. We are going to be having screensavers this year. So it's really important just to raise awareness. But there's a lot that goes behind that. So we have a weekly comms meeting every Monday to coordinate activity. Those started about a month ago for this year. What you'll see on the right, I just pulled this to show you. It's just one of 4 pages of the campaign activity that we keep a library of. So everything that we've done in the years gone by, we actually keep a library of. So we're not wasting time basically producing the same or similar comms. We also think that comms is important in terms of weekly board and triumvirate updates. So we let our leaders know every week what it's looking like in their division, what the uptake's like, and what we're going to do about it. And that really helps us to target activity. As Jag said, we need to have an idea about where the big wins are and where people just simply aren't completing their survey, so that we can undertake some in-reach. Staff side support us as well. Our chair of staff side sends comms out to the teams, and she will highlight the importance of the survey for the work that the unions are doing as well. Well packs were really useful last year. They're something that we introduced as a as part of the influencer campaign, where everybody who received their flu or COVID vaccination would receive a well pack. We made 7,500 last year, and each pack had a wellbeing directory, a leaflet, and essentially a brew kit. So biscuits, hot chocolate, tea, coffee, sachets. So that they, and a pen, of course, so people could go and fill their own survey in. We were encouraging people to take a break and go and fill their survey in, and also to raise awareness of the proactive wellbeing offer that we have to keep people well and in work. One thing I wanted to mention, which I used, was my Live Up Comms hat. We had given everybody who worked through the pandemic a £50 voucher during the spring of last year, and we were able to develop a database. So VivUp mobilised that offer, and we have VivUp as our salary sacrifice provider. So for those of you who do use VivUp, we now have an ability to send push notifications out to every member of staff who's registered an interest or bought something through salary sacrifice or received their £50. So if you have VivUp, it's useful to just send an all user comms to that cohort of staff as well. Just to cover off what's on the right there, you've got one of our medical directors with one of our well packs next to our branding. And on the right, it's just an example of the pre-survey comms that goes out to our triumvirates. I don't expect you to be able to read it, but if anybody's interested in anything that we produce, we're always really happy to share. So moving on to local activity, we are a small team. So there's myself and I have 5 colleagues, and within that we have wellbeing and engagement. So we come together during the staff survey to direct activity. And the first point I would make is that my team were already looking at the responses for last year and highlighting where to target this year. As a part of that, it's really important we like to go as early as possible. It just gives us that extra time, builds us extra time, and we're hoping to go on the 19th of September. So anyway, the CEO, she does support staff to take time to complete the survey. I'm not naive. I know that wards are really pushed, but one of our key priorities is to encourage staff to take breaks when they're due. So they'll have their well pack, and we will encourage them to complete the survey on their breaks if they can. We will be providing fortnightly managers individual response rate updates to promote the local awareness as well as accountability. So we started this last year, and although it's quite labour intensive, sending everybody their individual response rates, it's actually holding the managers accountable for the culture that they sustain in their teams, because they can't change it without knowing how their teams feel. And that links directly to a manager's action pack that we produce, so that when the results come out, managers can thank their staff and say, right, these are our 3 local team initiatives. So we undertake the weekly ranking of each team in each division, and we then let the HR business partners, we let our wellbeing champions know, and we ask them for their support as well. One of the areas that I've noticed we're not so strong as is the sort of directorate manager. So we're going to undertake some support for directorate managers this year as well. So my team are aligned to divisions, so they know the divisions, they liaise with the champions in their divisions, they will liaise with the triumvirates, and they will push the response rates in that division. Everybody also has the access to healthy trolley rounds. We know that nutrition and hydration is important. We also know that some staff are going without food and drink because of the cost of living crisis. We have had successful bids for staff benefits money, which is the funding for our promotional activity, to also stack our trolleys with those healthy snacks and treats. On the trolley as well, we have our wellbeing offer and booklets so that we can pass those out to staff as well. When we do go out on the wards, we offer staff the opportunity to sit and fill their survey in via use of our iPads, and we will sit with staff if they want to do so. We know that some staff may struggle to fill those in, particularly we have a really high incidence of international staff. at Blackpool, and we are conscious of literacy levels as well. I used to be an English teacher for adults, so I'm really mindful of that, and we're currently developing a campaign with our neurodiverse lead nurse to look at how we can respectfully support staff who may need additional help to fill that survey in, so we're truly inclusive. Just moving on now. As I mentioned at the beginning, engagement really is a year-round process. So our annual cycle is really key. I mentioned at the top of this presentation that we didn't have a lot of governance around the staff survey when I joined, and we all know that what gets measured gets managed. So we instigated listening events, our big conversations, which are held at divisional level and fronted by the triumvirate, to give the feedback, and we ask those 3 questions and people tell us what they want to focus on. We then draw those into activity plans, both trust-wide and within the divisions. Those are overseen at the Employee Engagement Sponsor Group. This is something that we took on from East Lancashire's great example. That is a quarterly meeting, and it's chaired by the Chief Executive, where divisions come and we don't hold them to account as such. We want to celebrate the good practice. We also want a really psychologically safe environment where people can say, tried this, didn't work, or can anybody give me a lift with this? This is something that we need support with. And then what's absolutely critical for us is to mobilize frequently. You said together we did examples. I've just taken an example there from our surgical division, just a few things that they fed back to their staff. And there's a poster which is actually a draft that we are feeding back on some trust-wide updates before we launch this year's survey. And it's really important to make good on any promises. We told our staff last year and the year before that we were listening and things were going to be different, that things would change. So we need to demonstrate that, and the governance gives us a really effective means of doing so. So top tips from us, I suppose. The first one would be to go early if you can, and to develop a multi-channel comm strategy. Keep the message really simple and consistent and focus on the why. What we found when we started to really dig into the staff survey a couple of years ago was people couldn't relate the time they spent filling in that survey to any change. So we keep telling people why and what will change. And email is not enough. Get out onto the wards, get into the offices, get into shared spaces. I know this is COVID specific, but just get out there and talk to people. We find that, yes, we have a really significant bounce when we have all user comms, but our trust doesn't really allow us to do very many. What we can see is a direct correlation between going out in a particular area and when the results come through, seeing the bounce on that area. Close the feedback loop on what's changed due to last year's feedback. That's absolutely critical before you go again. We're about to send that email out from the Chief Executive, just positioning what's changed from last year before we go again. Engage with harder to reach groups early on. So for us, for example, community groups are quite tricky to reach because of the peripatetic nature of their work. So we have deliberately recruited a lot of wellbeing champions and really found out when those key team and directorate meetings are. So we're in the diary and we're good to go and speak with those members of staff. And be creative. So somebody in the questions I know talked about engaging with doctors. We struggle with doctors as well. I've run a couple of medical engagement surveys and it is tricky. So we are taking a different approach, and each month we have a half-day shutdown for professional development with medics. I am going to go to 3 each month with our Associate Medical Director for Wellbeing to talk about their staff survey with them, and we're also presenting at our JLNC. And don't do it all yourself, you know, ensure that the corporate stakeholders and the local managers are engaged, they're, you know, actively support them, and make sure they're accountable, because they are able to move the dial in their teams. And of course, be data informed. We're really data informed. We know where we're targeting, why we're targeting, and we can measure the impact of that. Also, if something doesn't work, we learn from it and we move on. We're quite agile in changing direction. So that would be a real whistle-stop tour of how we do things at Blackpool. I'm very happy to speak to anybody or share any resources following this webinar.
Thank you so much for that, Susie. A lot of information there, but really insightful about how Blackpool have managed to see, I think it's a 23% increase in response rate over the last 3 years, which has been absolutely fantastic there within there. Most of the questions are quite open questions, so I do want to ask them of both Rachel and Susie, so I'll hold them. But there's one very specific question that came through, Susie, if you don't mind answering this, and that was what was in the wellbeing packs and the cost associated with those, if you have an idea.
So one of my colleagues has put something in the chat. I can't see it as I'm going up. I will just answer it on behalf of Lee. So we're changing the packs this year. So I can tell you what we're getting in this year's packs, and Lee might text me while I'm talking. So this year, here we go. Our well packs contained a copy of our well directory, a leaflet about the staff survey, a branded pen, a small pack of biscuits. It's like a blankety black checkbook and pen, a hot chocolate sachet, a pack of polos or love hearts, a tea bag and a sugar sachet, and the cost of each pack was £1.32 last year.
A lot of different wellbeing things there being added there. Thank you, Susie. I'm going to hold the rest of the questions until we open it to the wider panel. So Rachel, can I hand over to you? Rachel from the Dudley group here.
Fab, thank you. So a quick introduction to me then. So I'm Rachel Andrew. I head up learning, organisational development and culture at the Dudley Group, which is a kind of smallish district general hospital. So we've got 5,500 staff, and we've got adult community services as well as acute services, and 3 different hospitals kind of spread around. So some remote workers. Similar story to Susie, actually, and her graph where she's put the timeline of what they did from the wider organisation. I've just written down, I must do this for our organisation so that we can map what we did before against some of our increases. So in 2021, we had a 13% increase in our response rates. So we were at 58% in 2021, which was a massive leap for us. And having done the staff survey for the last 7 years, and for probably 4 of those 7 years doing the 35% every single year, was getting to be a bit of a drag. So and we tried lots of different things over lots of periods of time. So I think what we saw was from 2019 onwards was a gradual increase and then a bigger one last year. And if I knew what we did last year that made it 13%, I would be selling it. What I think happened is some of this is the yield of 3 years of lots of culture work. And I guess what I always see when I come to events where people talk about their successes is when, you know, I'm sitting here boasting about a 13% increase. If you're at the 35%, I know how it feels to be there, and I know how it feels to be there for a few years too. And so I guess what I wanted to focus on is kind of, I can focus on what we did in the campaign last year, but I think what has yielded our difference is some work that we've done over a period of time. And we also have teeny tiny teams. So I pretty much do staff survey, all of it, the admin and the coordination. But I've got a team of very good friends in my organisation now that I've built over time. So we started our culture work about 3 or 4 years ago with some implementation of some different ways of doing things. So we did kind of the wellbeing trolley, we called it Make It Happen, and we went around with no agenda and just served tea every quarter or hot chocolate at Christmas. Obviously pre-COVID, and you could do all sorts of things that were face-to-face and getting about. And so we kind of warmed up by asking people questions without a big agenda. So what would make the organisation great? And that kind of started our This is Organisational Change. And then since then, we've done quite a lot of work on leadership development and equality, diversity, wellbeing, and managers. So we launched our Managers Essentials programme about 18 months ago, maybe 2 years ago, where we're expecting all 1,200 of our line managers to do a 4-day management programme, which is just about management behaviours. It's not about how to manage a budget. It's not about how to do the stuff that they need to do. It's actually how to be a great person and look after the people in your team well. So I think that's probably one of the things. So we've done 400 of them in the last 12 months. So that probably helped us last year in the staff survey particularly. In terms of last year, the thing that kind of has yielded the success is that we've collaborated with my OD team, that we've got an improvement team and our HR business partners, and we've set up formal triumvirates as a working function. So we've got one member of each of those teams that is aligned to our three actual divisions in the organisation. So we've got a trio for each of the organisational functions. And so that has enabled us to kind of delegate quite a lot of the communication, quite a lot of the engagement work. So the biggest things that we did last year was, one, we took a real line manager view of the staff survey. So although we had a corporate campaign, which I'll talk about in a second, a lot of our work has been in really helping the teams and services understand why they need to use their staff survey, why they need to do it, why they need to talk about it to their staff. And it's also been helped because somebody who works for us, who's been with us for a couple of years, worked at Tesco for 20 years, and she said, my staff survey was my guide to my people. I was measured on it and I was held accountable for it. And if my staff survey performance was poor, then that was my problem as much as the organisation's problem. So we kind of switched a little bit in terms of how we focused on where it's at. So changed a lot of our focus last year and this. So last year, 2021, 2020 was the same, in cascading that responsibility down to initially the divisional leadership level, then to the directorate managers, and then lower into the kind of the band sixes who have much more connection with their teams. So we set the context last year, the year before last, sorry, and then last year did most of our comms through that that cascade tree rather than doing it centrally, which was a big shift for us as an organisation. And we've got sometimes a bit of hero leadership happening at the top. So there's a real tension sometimes within, we must do it all centrally. And we've started to work much harder at actually the people that earn this are the people who have it in their teams. And if they can connect with what it means, i.e. the results and how important it is, and it becomes their survey, then actually there is a much higher likelihood that they will take responsibility for it. And that seems to be working. And actually, even now, previously kind of staff survey peters out once the results have gone out in April. Even this last week, I've been asked for the questions from one of our finance teams because they've now set up mini promise cells within their directorate to take action on what wasn't so good last year. And they know it won't impact this year in terms of action because the survey is coming up. But we've been really encouraged by our board through the workforce committee that we're trying really hard on the long-term view, and that's really hard when the survey comes around every year. And for all of us, we're focusing on an annual campaign, but I think it's having that narrative that this is an annual campaign that is supportive of longer term change and longer term improvements and what it feels to work here kind of over a period of time. And so I guess the things that I think might be helpful from what we did. So one is kind of setting that up and building those connections so that you can get other people to help with the communications and the work on it, other people to be doing that prompting and those conversations. And we use email as a massive communicator. We also use quite a lot of social media. We've got a massive sign up to Twitter at our organisation. So a lot of our people are signed up and they've all set up kind of divisional department tweets. So we've got quite a lot of departments on there. And so last year it was really busy on some of the big kind of national celebration days. So we've used that power much more effectively for the staff survey. We did a normal kind of comms campaign similar to Susie in terms of kind of getting all that information out there. The things that we did that were slightly different is we map the peaks with the reminders. So we kind of set our reminders early in the campaign and then plan our activity in the fallow weeks, because we always see a big hit after the email prompts go out. So we tend to do a bit of pre-work and then nothing for the first couple of weeks, because it's generally pretty good for us in the first couple of weeks, and then kind of liven up the campaign as the campaign goes on, because otherwise you yourself can get a bit tired with a 12-week survey campaign, let alone the people. So I think it's doing those things and then doing things that are slightly popular to kind of engage and energize people. So we did coffee vouchers in the end of October, November last year. We sent them out to managers and they distributed them. They went to everybody. The managers were responsible for printing them off and distributing them. And it was with a plea and a promise that you get a coffee voucher and then you please do your staff survey. So a little bit of maybe emotional manipulation for people, but that worked quite well. The other thing, our comms team were absolutely epic last year. We had a new member of the comms team. It was his first staff survey year, and he brought lots of different ideas and energy to the campaign, which was really great for me, and is chomping at the bit for this year too as well. So you cannot underestimate having somebody good in comms who's got like different ideas about doing things to freshen it up. So they did a Q for You campaign, which is shortlisted for the HSJ this year actually. So what we did was we roped our volunteers in to queue in the canteen for staff. So whilst they were queuing for their lunch, they came and did their staff survey with our helpers who had laptops and iPads. And then when they got to the front of the queue, they just swapped out with the volunteer and they'd not only got front of the queue, but they'd got their staff survey done at the same time. And I can't take credit for that. That was comms. I helped them with some of those things. So I think it's, for me, the thing to do is think about your organisation and where you are and what the people want. And if you don't know it, then get some people to go and ask them some stuff. I've actually just seen one of the questions about marginalised staff, and I've just dropped a note to my EDI lead and said, can you help me with this? Because I've really not thought about this enough. What do we need to do? So there's learning for me all the time on the staff survey, and I'm often a bit like trying to get somebody else to do it, but probably I'm faking my disillusionment with trying to get it done because I'm as excited as anybody else with the challenge of where can I get to this year. And not so much the response rate's important to us because we want to hear the voices of everybody. I think it's the fact that we've also done that in conjunction with a much more robust plan this year on how we embed action planning in our divisions. So I can talk more, and if people want to contact me, I can tell you about some of the details of how we do things. I think it's just start where you are and understand your people, and then think about if you've got a small team, what is it that you can do without any money or resources? What can you do with a little bit? What do you need to ask for? Because we've generally done it on a bit of a shoestring, but if we ask for resources because the response rates aren't quite there, generally our exec team is like, yeah, like do this, or they make suggestions. We've had really good buy-in from our chief nurse, our medical director, and the COO and the chief exec. So that's helpful because they're quite keen to go out and do stuff. It's also motivated our divisional leaders. So our kind of chief of medicine for each of our operational divisions. So we've kind of started to use that cascade, and that's been the thing I think that's helped us the most, is that we're trying to get it across the organisation and it doesn't just sit as, oh, it's them corporate people trying to get us to do this survey that has no value to us at all. And then the second thing is on action planning. So as I said, it's like we're still action planning from last year's survey. So the divisions, we highlighted a league table, which I know some of my peers in some of the other trusts have done, of the 11 areas that performed the poorest against our organisational goals. So we targeted them with a support crew. So we didn't say, you're just rubbish. We said, we've got this support crew, we do lots of work around this, and we go out and say, right, what do you want to do? And then how can we enable that to happen? Our finance team, I've already congratulated them because they've done a beautiful job this year of kind of divvying it up. They've given responsibility for each promise to one of their managers, and then the managers have come back to us and said, can I have my results? Can you help me? These are my plans. I'm asking the staff. So I think we've just really localised it, and we've done that because we've done some of the work underneath that. But I think also we just recognise that you need to talk to your people, and actually, if you can't impact the whole organisation, just do the work where you can improve the most one year and then carry on building on that as you go along. Because if you look at your response rates now at 36% and think, blimey, how am I going to get to 65, which is our goal next year? If you'd have asked sad old me in 2017, I'd have said, I don't think I'll be here by then. I'll be gone because I can't do 30%. Whereas I'm kind of now thinking I can do another 7% next year because I know where we need to work in our own organisation. Yeah, I think that's it for me. I think the top tips for me are find a crew of people who want to do the work on this. And it might be corporate functions, it might be using, you know, those champions that are really keen to do stuff in the organisation anyway. It might be curious people, it might be your leaders that are doing their master's studies or leadership studies, and they'd have a module on engagement and they're very interested in how to do it. It might be that you've got just people who are naturally great at engagement and how you support them locally. I think the second thing is recognise where you are. So there's loads of organisations doing great things, and it's great to learn from them. I guess I always think, how will I make that work with the people in my organisation, and then what might I need to do differently to support them because their challenges might be slightly different. And I think celebrate what you've got in terms of a 1% increase, or staying the same sometimes is as good as a 13%. And I think one of the things last year that I learned is we had a really big peak in 2020. We had great results for the first time in my history at my organisation. And I said it's a tiny trumpet celebration, because I don't go very excited about it, because I know the staff survey, you're measuring things from actually now for some people because it's an angry day, or you're also measuring things that you've put in place quite a long time ago. So not only did we do quite well on response rates last year, we stayed the same, which was kind of success. And from that platform, I've managed to convince my workforce board colleagues to take a longer term view of the staff survey. So although we're going to be looking at it with interest this year, they know that the impact of the work that we're doing is probably next year or the year after. And that's taken a bit of time and holding the line sometimes. And I think remembering that you are not alone on the staff survey, so not only in your own organisation, but all of the people on this call and all of the peers in the NHS are happy allies and advocates. And often we are learning from other people. I've written loads of things down that Susie talked about, and also very willing to share what we're doing and maybe helping you think about what we did and how that might work for you too. Thank you.
Thank you so much, Rachel. I am going to open it up to the floor to add questions. Feel welcome to pop them in the chat or to put your hand up and I can unmute you to ask them. But we've had quite a few already submitted and some questions that were pre-submitted. So I'm actually going to start with one that was pre-submitted that I think is quite a tough one, but came in from a number of people. What has been, and this is to both Susie and Rachel, what has been the biggest challenge that you faced with the NHS Staff Survey, and how did you overcome it? What was the results outcome? Rachel, do you want to pop in first? We can go.
I'll go first, of course.
Yeah, I could see you going for it.
I think the biggest challenge is, for me, you don't seem to get kind of that breathing space. So I was joking with somebody last week saying, oh, don't ask me about the staff survey, I'm just about getting ready. And then everybody's going, what, it's coming round again? So although it's a year, it's never a year. It's usually about a few months where you've finished the old and start the new. And I think because I think there's a real underestimation of, one, how big a piece of work it is. It's actually a piece of work on its own, and not just that, like, kind of getting the survey out there, but making it meaningful for people, really making sure they understand how it relates to them and what impact it has, but also kind of that bigger relevance. So it kind of ties in much more to engagement. And then, so that's one of the biggest challenges, I think. And then I think the second thing is the scale of it, because you're trying to do it in an organisation in one period of time when everybody is thinking about something else, which is winter. And this year, winter is already a bit worse because we've not had a summer and it's kind of been winter since COVID. So I think it's that lack of control over something that you know you're going to have to do well. So it's silk purse sow's ear kind of territory all the time. So I think for me personally, it's staying excited about the staff survey when everybody else is not.
Susie, did you have something similar or different there?
Yeah, we've got so many competing priorities in our trust that are wanting the airspace. We've got a lot of work streams around financial well-being and the cost of living pressures. We've got obviously a lot of clinical work streams that we're and initiatives that we're highlighting. So it's maintaining the profile of the staff survey, keeping it fresh, and actually that I talked about, that psychological contract with our staff. It's letting them know that things have changed and they will continue to change, but it doesn't happen overnight, because as Rachel said, we're still working on the plans from last year. We've just drawn up our action plans and had them signed off. So although that's developing, I think there's a perception that if stuff doesn't happen immediately, it's not happening. So it's making sure that people are aware of the full action planning and deployment cycle for us. And actually the other thing I'd add to that is making sure that I look after my colleagues, because it's really hard work for them. 12 weeks going out and about, it's tiring.
That's good. Good advice. Good suggestions from both of you. And I think with both of you touching on that longer term engagement, that this is that touch point for the survey, but actually the plans are much longer, they're ongoing, and just keeping staff updated as to how that progressing can be really quite effective. Slightly different technical question here. Do you have any advice for engaging those staff who do not have laptops, computers, or limited access to emails here?
So for us, we run clinics where we will go out onto wards and we'll promote it, and we will have the iPads, and we will sit with people and have a brew. And I actually think, having read that question last night, there's some scope to development. And one of the things that Rachel mentioned that I want to do is make sure that we're more inclusive in our approach. I think I did reference we're working with our lead nurse for neurodiversity, but I think it should be business as usual and woven into how we do business. So it's an ongoing work stream for us, I think.
So we did similar in terms of the clinics and out and about, and people had quite local solutions. So we were encouraging the managers to kind of swap out shifts, so they would set up in their local offices and help people. Our IT desk were amazing in terms of resets, so they gave us a shortcut that enabled people to reset their email accounts really quickly. It was, I think it was F1. I never used it, but so our HRBPs went out with laptops. Our business partners in HR, sorry, went out with laptops and iPads and did some of that with people. We've done quite a lot of work on digital in the organisation in terms of moving over to digital staff records. So we've done quite a lot of work on that, which is why we still do an online census only. We don't do any paper surveys, although we had offered them last year. We also sent letters out, which I know is not digital, in the snail mail to people's home addresses for those who were low IT users, saying if you've got a home email address, we can send it there instead. Just let us know and nominate to that. So I think it's just trying to find what the smaller problems are and solutions. I think what we learned was, you know, some of the things that people say, like IT usage, we don't think that's as big an issue as it is. It's an issue for some of our users, but it's smaller than we don't trust the organisation that it's anonymous, or I don't have time to do it. And actually all of those messages are, I'm not interested in doing this survey because it's not important enough to me. So that's what we've tried to work on, is how do we make it important enough for people to overcome the obstacles or ask us for help with those obstacles.
A practical question that relates to this from Lindsay that's in the chat here. How does the iPad work for them completing their own survey? Both of you mentioned this. So how does that work, especially if they do not have or use their NHS email?
So for us, we've got IT to set up the shortcuts to NHS Mail and the reset. So they do that first and then they access it through there. So it does require that they go through their email. I mean, this is one of the biggest challenges with the staff survey, is it not? Is that it goes through emails. If it was a smart code or a text message link, it would be much easier. So I think we do as best we can. It will limit us when we try and get higher and higher in response rates, because we've still got some challenges with that.
And we're exactly the same. We that's exactly how we approach it as well, and we share your frustrations about that.
Yeah, it's that they do not use the NHS email, so it's giving that access to the reset functionality there.
And I guess also we know that communication via email is the cornerstone of our organisations. So there's something for me about how do we help them recognise that's important? Because if people aren't checking their emails, why are they not? Because they are still missing out on other comms that are important. Our pay slips are online, all of those things. So I think there's kind of that, it's connected to that awareness of digital is important too.
A practical question that came in earlier was, and I'm going to send this one to Jag. Do you get translation services or for filling in the survey?
Okay, so we do. The guidance from obviously NHS England and the Coordination Centre, they don't actually provide translated versions of the questionnaire in any form. However, we are aware that there is going to be a need for this. So we have the helpline, and again, this is can be used for if somebody's struggling reading. So you can they have access to the helpline telephone number where they can basically complete the survey and have access to a translator of any language that they need, or it could be read out to them in English. So that the capability of doing that is available through Picker.
Thank you very much there, Jag. Another question that's come in through the chat is, are you able to give a little bit of an explanation about your staff engagement network, employee engagement groups in your organisations, please? Susie, do you want to kick this one off?
Yeah, so we've got nearly 200 wellbeing and engagement champions, and we're really proud of them. We have a monthly drop-in session and then online training sessions every month, and we deploy our activity through them. So with respect to the staff survey, we've got a drop-in event on either the 5th or 6th of September, and they're coming to be briefed to understand why it's important, how they can support their teams, and how they can increase their own response rates. So although it's an annual programme of activity, we do ask them to specifically support the staff survey during the fieldwork period.
Thanks, Susie. Rachel, did you have something as well?
So we've got a range of staff networks, and what we do is, because they're generally our operational staff, we ask them how they can help and what they do. So not exclusively around how do we deploy them, we actually do most of that work through our corporate functions and then our connection to other champions and networks. But I think we use their intel as much as anything in terms of what do they know about the organisation and what barriers do we need to overcome.
This was quite a direct question that was popped, that was pre-submitted. What do you think is your best tool for communication? So they've given examples of email, social media, staff chat, but how do you effectively get the message out? I feel from both of yours, it's a bit like bombardment here, but I'll let you answer this as well. Rachel, do you want to go first on this one?
I think people. So although we use social media, we use email, it is the personal peer-to-peer that is the most persuasive. We've done really well in those areas where the leaders take the responsibility for making it work for them, or where we've got really great relationships. So because we've been doing this kind of support crew thing with targeted, so 11 departments last year, a different 11 this year. So we've got kind of 22 teams that we're really engaged with. I would be expecting great things from all of those 22 this year. So I think it's find people who will talk positively about it and be the advocates, and it doesn't necessarily have to be the people who do it for a job, because that is what persuades people in the NHS. They are people. So email's great, and that works for some people. Some people are very compliance focused. If you want to go big in terms of response rates, you need to make it a conversation that people have as a conversation between them, not just between you and them.
I agree. I think it is absolutely our people, but I think it's those conversations and those touch points that we have when we go out and about that build trust in the process and ultimately convince people that it's a really good use of their time, because you tend to find that when you're speaking to people, they have various different concerns, either around the confidentiality, I suppose the purpose and the point, that nothing will change, and it's just an opportunity to have those one-to-one conversations. And then I think we've seen that when our staff do go out, the year later, there's still that increased trust in those teams. So it really does pay dividends.
And I think that probably leads quite nicely through to this question, and I'm going to pull this as the closing question, although we're drawing towards the end of the time here. What do you think has been the key to demonstrating the value of this survey's results to your leaders and colleagues throughout the organisation? Tough question.
It is a tough question. For me, I think the cultural insights are really valuable because they're a real call to action. And I know that we're actively trying to improve our culture. And so that the data has been a real, has been the cornerstone of everything that we're doing in terms of our leadership development, our EDI networks, you know, improving personal safety. So that's been the value. The challenge is to actually move the dial and prove to people that we've changed how we approach things.
Rachel, did you have anything to add to that?
Yeah, I think we've tried to tell a very good story, particularly at board level, about how do we connect what the survey says with the work that we've done, which is that graph that Susie showed on her first slide in terms of what have you been doing and where does that yield impact. And so this year we picked out some of the areas that we'd done very proactive improvement and culture work over the last 12 months and then mapped their staff survey results. And in a year when nothing really improved much, theirs did. So I think it's that data, using the work that you do and trying to kind of align it together, and really focusing on, we can all do lots of things that improve the short-term experience of staff on a day-to-day basis. You know, it might be a microwave, it might be a kettle, it might be something very simple that's solved, but actually the things that fundamentally change what they do are the things that the staff survey reports on. It's about their experience of line managers, which has been our focus for about 2 years. It's about embedding wellbeing beyond the surface wellbeing stuff, which is important, but it's also about breaks and rotas, and it's about shift patterns, and it's about flexibility. So I think it's helping convince our exec leaders that the staff survey is a measure of broader organisational culture and engagement. It's not just a staff survey. And I think it takes a little bit of time for them to get that. I feel like ours are very much in that zone now in terms of what is important and how do we measure it is the staff survey. How long will it take? 2 or 3, 4, 5, 6, 7 years.
Thank you very much. And I do want to say thank you very much to all of our panelists and everyone who has taken the time to join us today. Hopefully they were, and it says in the chat, there's a lot of people saying very interesting presentations. And thank you all for the questions that have been submitted. For those that we haven't managed to get to for the questions, we will send you direct messages if we have your email address associated with this meeting to give you some responses directly. But in the meantime, if you have any questions or thoughts or input, please do feel welcome to contact us. Jag is just going to drop the email address for PICA staff surveys into the chat, and this meeting will be, the recording will be circulated to everybody after the event. Thank you so much for joining us, and thank you, Susie, Rachel and Jag in particular for leading this. Thank you so much.